Okay, perfect. Awesome. So this is our Medicare with Confidence presentation. The goal is for everybody on this call to feel just that much more educated around Medicare and what's going to be the right choice for you in your household. This is me, just like Mike said, I'm a Medicare insurance broker, licensed. I did all of the fun work to make sure that you have a specialist to call when you're at this point in your life, just deciding whether or not you're going to enroll into Medicare. So today we're just going to go over Medicare basics. What's Part A? What's Part B? Important terminology when it comes to healthcare. Mike mentioned enrollment periods, and some of those are irreversible. So making sure that you are very well educated on what the enrollment periods are for Medicare. Our different plan types. So examples of that are Medicare Advantage plans versus Medicare supplement plans, plan recommendations, and cost assistance programs. All right, so an overview of this presentation, again, it's a high-level overview. So while I can't get into specifics on different insurance carriers or answer very specific questions regarding your current health insurance plan, again, we want you to feel really confident with what does Part A and Part B cover? How am I eligible for original Medicare, which is, again, is just Part A and Part B? How much does original Medicare cost? How do I apply for it? Where do I call? Who do I go to? And additional Medicare plan options. So education is power, knowledge is power. The more you know, the easier it's going to be for you to choose a plan that's right for you. So getting this education today and then having an ally, or what I like to call like a concierge service for your Medicare health insurance questions, will be right here for you to make that right choice for you. So typical question, what is Medicare? I get this question all the time. People say, did I pay for it already? I thought Medicare was free. Who supplies Medicare? So the basics of this is that Medicare is a federal health insurance program. It is run by CMS. Center for Medicare and Medicaid Services is a governing entity that regulates insurance brokers like myself, private insurance carriers, and just like, Canter Wealth being in the financial industry, Medicare insurance is an extremely regulated industry. There's a lot of red tape around soliciting to seniors, making sure, the reason why I mentioned earlier that I have to make a disclaimer that this information is subject to change is because it does change every year, which again is another reason to have a Medicare insurance specialist, to have a partner like Canter Wealth to say, I need to review this each year. The last part of this, that it is a part of the U.S. Department Health and Human Services.
I think a lot of people think Medicare is free. Can you comment on that a little bit?
Oh, absolutely. Yeah. When I was getting licensed, everybody asked me, you're going to sell Medicare health insurance plans. Isn't Medicare free? So the easiest way for me to answer this is typically Part A as an apple, or what's known as your hospital coverage, is free, is a $0 premium. However, you do need to qualify for that to be free. And the qualifying events for just Part A to be free to you is having worked 40 quarters, or what divvies down to 10 years of your life, paying into FICA or payroll taxes. So as long as you have been paying into your FICA through an employer plan or payroll taxes, you have, whether you realize it or not, you've been paying into Medicare to get your Part A for free. We'll go into the details around Part B, as that premium is not free. So A, you'll get for free if you've worked for 10 years.
but if we lift the hood a little bit, it's really not free. We've been paying into it all along. It just becomes free at the point in time that we stop paying FICA and potentially take advantage of it.
That is absolutely correct. It's a program that you've already paid into. So I'm paying into it right now myself.
Right.
It's a great question. Okay, so important terms. This might seem a little elementary, but I go through this with every single one of my clients because you need to understand when I'm going through benefit options with you, you understand the difference between a premium versus a copay. So you can think of your premium is your monthly payment for either your Medicare card or a Medicare insurance plan that you would consult me with, either a Medicare Advantage plan or Medicare supplement. It's that monthly plan premium that you'll pay to have that plan. Deductibles is the amount you're going to pay prior to the plan coverage. Copays, we love copays in Medicare insurance plans because they're fixed amounts. This is a number that you can rely on that does not waver. A copay is a copay is a copay. So fixed amounts at the time that you pay either for a doctor's visit or a hospital stay. And co-insurance is kind of exactly how it sounds. Usually this looks like 80-20 coverage. So we'll get into the nitty gritty of Part A and Part B, but just to put this out there, original Medicare, Part A and Part B, covers only up to 80%. So this is a co-insurance situation. If you just have your Medicare card, original Medicare is going to cover you 80%. But the co-insurance portion is going to require you to cover that 20%. Okay, so that was kind of an intro into this next chapter, which is that original Medicare covers many, but not all healthcare related services. So we never want to put any misinformation out there or give any type of idea that once you get your red, white, and blue Medicare card, you are good to go. That's why we're here today, is to educate you around what's A going to cost, what's B going to cost, and what's it going to cover. Okay, so Part A is what's your hospital coverage. Again, I know I mentioned this earlier. Please remember this number. Part A will cover your hospital insurance only up to 80%. And on the left-hand side of the screen, here are some examples of what your Part A hospital insurance coverage is going to help cover. Hospital stays, of course, skilled nursing facilities, hospice care, home health care at 80% coverage, okay? Like we mentioned earlier, for most people, if you've paid into FICA, you're not going to have to pay a monthly premium for A. It's going to be free to you once you turn 65 or enroll into Original Medicare. For those who don't qualify for Part A, which there are individuals that don't qualify for Part A, there's a buy-in option, okay? It's a pretty penny. However, it's my job to tell you guys the facts. So if you want to buy into Part A for 2021, it will be as low as $259 per month. It can go all the way up to $471 per month just for Part A. Okay, Part B, medical insurance. And again, remember that Part A and Part B is what's known as original Medicare. You receive this from Social Security. Your Part B coverage, again, only at 80%, is going to cover your medical costs, like your doctor's visits, outpatient care, vaccines, durable medical equipment. An example of that would be, oxygen or a wheelchair, maybe crutches, home health care, screenings, cancer screenings. The cost for this year, 2021, the standard premium is $148.50, and that is nationwide. So if you're enrolling into Original Medicare, you can count on your Part B premium costing $148.50, and that is also subject to change depending on your income, your taxable income.
Can you explain the Part B premium and kind of the tiering system? And I know that there's also a look back in terms of the income thresholds. I think that's worth kind of touching on a little
Absolutely.
bit.
Yes, absolutely. So I mentioned the standard premium is $148.50. Please do not lock this number into a confirmation that your specific household is locked in at $148.50. Just like Mike mentioned, there are brackets to your income, and the look back is a 2-year look back. Okay, so for this year, if you're enrolling into Original Medicare and you want to apply for Part B, Social Security is going to do a 2-year look back to see what your taxable income was for that year. That's going to determine your Part B premium. There are brackets that go up and up and up and up and up, but I'll just give you one example. For an individual, if your taxable income is less than $88,000, you will fall under this category of $148.50 for your Part B premium. If it's a household and your joint taxable income is less than, I believe it's about $176,000 combined taxable income 2 years ago, you will fall under the $148.50. If you get above that bracket, it starts elevating. The premium's going to be higher. So the next payment price above $148.50 is $207.90. Okay. And then, we can obviously, if you've got questions about your taxable income from 2 years ago, and I haven't mentioned your personal bracket where you're in for taxable income, reach out to Mike. We can get together and I'll let you know what that specific number is, but that's just an example. Standard premium $148.50. Most individuals fall under this category. However, the more you made, the more you're going to pay for Part B.
And one of the questions that we got last time was, is this something that Medicare evaluates each and every year, or is it just sort of set the first time they look at your income?
No, there's no grandfathering in with these premiums. They're subject to change each year. So, think about individuals that, win the lottery, or they sell a house or inheritance, or you were making a lot of money 2 years ago and your business went under. It's not ethical to keep you at, let's say, that $207.90 price. So your Part B premium is reevaluated. Okay, so who's eligible for Original Medicare? I'm sure you guys are well aware of this one, at least. Age 65 or older. Now, if you have disabilities, so for anybody that has been deemed disabled by the state for at least 24 months or 2 years, and you're under 65, you can also apply for Original Medicare to have Part A and Part B. So obviously 65 or older, that's the golden age for seniors applying for Medicare. But again, if you were deemed disabled and you've been disabled for longer than 2 years or 24 months, you can apply for Original Medicare. You have to, an option to be eligible is having end-stage renal disease in the 4th month of dialysis, ALS in the 1st month of diagnosis. You do need to be a citizen of the United States, of course, and also a legal resident for at least 5 consecutive years. So not bouncing around, living here for 5 consecutive years. Okay, so this number I have engraved into my brain because I give this number out every single day. Option number 1, okay, so let's kind of paint the picture. You guys reach out to Mike, to Canter Wealth, and say, I'm coming off of my employer plan, or I'm turning 65. I need to enroll into my Medicare card. What do I do? Our first options are either 1, 2, or 3. You can go to a local Social Security office. I will tell you that I don't know of any that are open right now since COVID. Last year, that was not an option for any of my clients turning 65 to set an actual in-person appointment. You can always go on to ssa.gov to see if a local Social Security office is open near you. If you are tech savvy and you don't want to meet anybody in person, you can apply online, again, at ssa.gov. I will tell you guys, my suggestion is to call. I say this because I've had enough clients that maybe thought that they submitted their application and were waiting a couple of weeks and missed one little piece and it didn't get submitted correctly. So I'm a little old school in that I like talking to an individual. I want them to confirm what my individual Part B premium is going to be and that my card is on its way. So that number is 800-772-1213. And if you don't write it down now, just know I have it. I know it like the back of my hand. The TTY numbers for individuals that are hard of hearing. But these are three, this is the floodgate. So if you need your Medicare card, it's one of these three options, whichever works best for you that you're most comfortable with.
Yeah, and as an aside, we call that number all the time, and sometimes it takes a little while to get through, as you can imagine.
Oh yeah.
Um, But what we have found is actually they're very helpful when you get through. When you get through to someone, you usually get someone very, very knowledgeable. But what I will say is they are just informative. They're not going to guide you, right? And so they're great at giving you information, but they're not going to sort of guide you to the most prudent choice. However, again, the overall point is that they are very helpful at that number. Surprising.
Right. Right. Well, and at their level, Social Security can only enroll you into A and B. So that's their job. You know, I have to make this very clear to clients when I'm walking them through, here's your three options. I am not Medicare. I am not Social Security. I am an insurance broker that once you get through this point and you get your Medicare card, then someone like myself is going to give you that concierge service to pick the right Medicare plan for you. So Social Security are not insurance brokers. They're at their call center answering your questions regarding if you're eligible for A and B, what's your B premium going to be, when can you get your card delivered? They will, just like Mike said, they will answer all of your questions. And then once you get through that point, you'll work with a specialist like myself to get your supplemental coverage, right? Because your Medicare card's only 80% coverage. Okay, so let's talk about individuals that are turning 65. Okay, you are a baby boomer. This example on the screen is for someone that's turning 65 in April. You have a 7-month window to enroll into original Medicare Part A and Part B and choose supplemental health insurance like a Medicare supplement or a Medicare Advantage plan. So that 7-month window consists of 3 months before your 65th birthday, the month of your birthday, and 3 months after. So a disclaimer that I want to make sure everybody's really clear on is that if your birthday's in April, you can absolutely call Medicare Social Security to get your A and B card either in January, February, March. But when is your effective date going to be for your Medicare card? Your birthday month, of course. Okay. Have I had individuals call me, in the middle of their birthday month and say, I didn't do it. I was busy. I was traveling. Last year was crazy. What do I do? Say, no problem. You still have April, May, June, July to get your ducks in a row. But as an example, for this individual turning 65 in April, if they called Social Security and said, hey, my 65th birthday is this month, Social Security is going to create their effective date for the very next month, for May, okay? The first of the month. All health insurance plans, your original Medicare card are going to start on the first of the month always.
What happens if you miss that 3-month window after you turn 65?
We have a slide for that. That's called the open enrollment period, which unfortunately does happen. So you've got a pretty good chunk of time in your year. You get 7 months. When I'm working with clients, I am always working with them to get their ducks in a row before their birthday, right? I mean, because we have such wonderful benefits that you're eligible for once you're a senior in the United States. Why not get those at the top of your birthday month? We don't want to, why wait? So, I'm reaching out to clients of mine. They're talking to me a couple months before their birthday month. And that is my professional opinion, is not to wait to the 11th hour and to start getting everything in a row and start asking your questions. We can start looking at plans even a couple months prior to your birthday. Okay, very next slide. So Mike, you're onto something. If you missed your enrollment window, you missed the 7-month window, and this does happen, you have an opportunity, which is called the general enrollment period, to get your Part A and Part B. Okay, but here's how it works. January 1st through March 31st, you can call Social Security, go online, however you want to apply, And you'll get your Medicare card if you are eligible, January, February, or March. However, your Medicare coverage will not start until July 1st. So this is many months, that we're waiting for that summer July 1st effective date. But these are just the rules. I don't make them up. You've got January, February, and March, get your Medicare card. And then you would work with an agent like myself in the months of either April, May, or June to pick a supplemental plan. And your plan will start and your Medicare card will start July 1st. Okay, so there is an answer to that. However, you got to wait. Okay, so we've got special enrollment periods. This applies, and I think just demographically, I think this applies to a lot of my Canter Wealth inquiries, are individuals that are coming off of group employer plans, or they just want to ask, is my group employer plan really good, or am I overspending for my health insurance at this point? So on this slide, it does say at the very end, during 8 months after enrollment or group coverage is when you can apply for A and B. Okay, so technically, if you lose your group coverage or you retire, you will get 8 months to enroll into original Medicare and a Medicare Advantage only plan. Okay, so this does not include Part D or prescription drug coverage. So personally, I don't usually suggest waiting 8 months in general. I mean, who wants to wait eight months? Go 8 months without health insurance coverage. We want to be getting ahead of the curve. So if hey, I'm coming off of this employer plan, I'm retiring in July, or hey, I got let go, my company is allowing me to stay on the group health insurance coverage through the end of the month. You want to get in contact with myself as soon as possible so that we can start looking at options, because the days that I want you guys to remember, the number that I want you to remember regarding coming off of group insurance is 63 days, okay? Because you have 63 days to enroll into prescription drug coverage. So I want that for you. We don't want to miss a Part D enrollment, because that's a penalty in itself. So please just, if you're writing notes, or if you could just mentally grasp this, coming off of a group employer plan, think of 63 days. That's our window.
And how would that affect a spouse? If we have one working individual and then a spouse that's covered by the working individual's company plan, how does that fold into things? This
happens often. A spouse is the primary on the group insurance plan, and the husband or wife is covered underneath that employee coverage. So first things first, myself and my partner Tracy, we want you to be communicating with us well before any of this group coverage ends. So getting in contact with us just to let us know what your family household is looking like. How much time do we have to get all of our ducks in a row? So we have a couple of options. Option number one is if you can keep the employer coverage and you're not retiring, we always will look at what's the richest option for you. Sometimes employer benefits are fabulous, and it really wouldn't make sense for you and your spouse to go on to Medicare and or enroll into a Medicare Advantage or Medicare Supplement plan. We have absolutely told clients, stay where you're at, don't come off of the employer coverage. The second piece to that is if you are let go or if you decide to retire, we need to see what the age difference is between you and your spouse, because ideally you are both 65 when you come off of that group insurance, so that we can get you onto Medicare and choose a Medicare Supplement or Medicare Advantage plan. Because if you retire before your spouse that is covered under the group insurance is not 65, you'll be good to go. We'll get you Medicare and a Medicare Advantage plan, but your spouse is going to be left high and dry paying for an individual health insurance policy, which we all know they're not cheap. So just before you make any, quick decisions with coming off of employers' plans, retiring, please consult us and we'll get you to the direction that's going to be the most cost effective for your family. That's the goal. Okay, so eligible persons can choose additional healthcare options to assist with all sorts of extra benefits. So prescription drugs or out-of-pocket expenses. And we'll go into what those different options are. I've mentioned it many times before, Medicare Advantage plans or Medicare supplement plans. So we'll do a deep dive into that. Okay, so here are our 1, 2, 3 options. You are going on to Medicare. You've called Social Security. You've got your Medicare card. What are the 3 ways that I can be covered? The first option is you have your original Medicare card. As you guys can see on this example, it has hospital Part A, medical Part B with an effective date. This is your 80% coverage for hospital and 80% coverage for medical. You can walk around this world with that card with 80% coverage. You will not be penalized. You are good to go. However, it is extremely vulnerable because you're only 80% covered. So any bill that you receive, which could be a hip replacement, an ambulance ride, you really don't want to be in a position where you're responsible for 20% of that entire bill. So option number 1, you can have your A and B card and pick up a Part D plan from a private insurance carrier, and Part D is drug coverage. Option number 1 is A-okay. It's not my recommendation. I wouldn't suggest that to my own father, but you won't be penalized for having A, B, and D. Option number 2 is what's known as Medicare supplement coverage. So of course you have to have A and B, got to have your original Medicare card to enroll into a supplemental plan. Medicare supplement plans supplement that 20% that A and B doesn't cover. So again, you'll enroll into a Medicare supplement plan with a private insurance carrier, and you'll also need to enroll into a separate Part D plan with a private insurance carrier. The main aspect to remember about Medicare supplement plans is that they are not within a network. You are not bound to any networks. So you have the flexibility to see providers anywhere you choose without a referral. And some people, this is the way that they want to go. This is what's meant for them. So this gives you much more flexibility because you're not bound to a network. You can go anywhere that Medicare is accepted with a Medicare supplement plan. Just remember that you also need to purchase a separate Part D plan. You do pay for this privilege to have that flexibility. Okay, typically Medicare supplement plans can range really anywhere between $95 for new to Medicare with some new to Medicare discounts, anywhere up to, $150 for your first year being 65, and Medicare supplement premiums go up every year that you get older. Medicare Advantage plans, I like to think of as a bundle effect. Okay, so again, it's that 20% coverage. You have to have your A and B card to enroll into a Medicare Advantage plan. They include your prescription drug coverage and your ancillary benefits. So it's kind of a package deal. Again, you are usually in an HMO, but typically Medicare Advantage plans are a $0 premium. So it's do you want the free health insurance plan that's an HMO? Maybe that works for your life and your doctors are in network, no problem. Or you need the flexibility of a Medicare supplement and you're willing to purchase that health insurance plan.
Well, what if someone has dual residency, or maybe a house in California and a house in Arizona, or they travel a lot, or they like to see multiple doctors in different networks? How does that kind of apply?
We're going Medicare supplement plan. And at the end of the day, you just have to realize that you are responsible always for paying for your Medicare card. So just say you're at the standard premium of $148.50. You will need to pay for the Medicare supplement plan, which again can range anywhere between as low as $90. It could go all the way up to $150 in that first year. And you also need to purchase a prescription drug plan, and prescription drug plans will range anywhere from like $7 to $100. So it's the more expensive option. However, if it's conducive for your life and you see specialists in and out of networks and you travel or you have a second home, I would not recommend an HMO policy. Okay, so let's discuss prescription drugs. Federal government requires members to have minimal drug coverage. So it doesn't matter if you don't take prescription drugs. I hear this all the time. Well, I'm not taking any drugs. I don't go to the doctor. You need to enroll into a prescription drug plan or a Medicare Advantage plan that includes Part D so that you are not subject to penalties. Okay, prescription drug plans, they have drug formularies, so a list of all the drugs that are covered. They're sold by private insurance companies. They usually have monthly premiums unless they're packaged into a Medicare Advantage plan. They'll typically have co-insurance or what's known as tiered copays. So most prescription drug plans are based on tiers 1 through 5. The lower the tier, the lower the copay. The higher the tier, the higher the copay. Okay, so tier 5 drugs are typically going to be your specialty drugs. Just like I mentioned before, the two ways to obtain is just you can enroll into a standalone Part D plan. Okay. Option number 2 is you enroll into a Medicare Advantage plan that includes your prescription drug coverage.
One of the questions we got last time, and one of my favorite questions of all time, was, does Part D cover Viagra?
Yes. Yeah. There are Medicare Advantage plans that cover that it's included. Yes. All right, let's discuss Medicare supplement insurance. Over 14 million Americans are on Medicare supplement plans. This might be the right option for you. It's really about working with a specialist like myself to discuss what your household looks like, income, if it's feasible for you, and what's going to be the most cost effective for your life if you need that flexibility of not being bound to a network. So MedSup plans, they help cover costs and services that are not covered by original Medicare. Because remember, you've got A and B at 80%. You need the 20% coverage through your MedSup. It'll help with out-of-pocket costs and can include some copays. Typically, there is a deductible, a very small deductible, and co-insurance. If you guys have family members or friends or colleagues that are on MedSups, they're the most common plan types are what are known as Plan G, Plan N, or Plan F. But just know that Plan F is only available for people that have turned 65 prior to January 1st of 2020, okay? Some additional details about MedSups. They're sold by private insurance companies. The premiums vary depending on what state you're in. They can require underwriting. So this means if you don't enroll into a Medicare supplement plan during the honored enrollment period, you are subject to being underwritten, which means the private health insurance company has the right to do a look back on your health history and has the right to deny your application. So that's why we always want to honor our enrollment period so that you can get through without having to be underwritten. They're often paired with original Medicare, so your A and B card and a Part D plan or prescription drug plans. And just like I've said many times before, you've got to have A and B. Okay, our Medicare Advantage plans. So a deep dive into Medicare Advantage plans or Part C. They are, honestly, increasingly popular due to the low cost options. Like I mentioned before, typically Medicare Advantage plans are a $0 premium. You got to have it covers your Part A and Part B. Most often covers prescription drugs, so includes Part D. Most premiums vary by plan, but they can be as low as $0 a month. They have annual max out of pockets. You can expect a maximum out of pocket. They're typically pretty low. You have a network of doctors and hospitals. So if you want to go HMO route, Medicare Advantage plan, because you love the idea of a $0 premium, just be prepared that you gotta play the game. If you want a referral, you got to go to your primary care doctor first. If you want to have your surgery, you need to make sure that the hospital that you want that surgery located at is in your network. They are also sold by private insurance companies. They are typically guaranteed issue, so without underwriting, and they're not paired with Medicare supplement plans or prescription drug plans, okay? So the Medicare Advantage plan is our bundle effect. This is your 20% coverage with your Part D coverage, and it also is going to include your ancillary benefits. Must be enrolled into A and B. Got to have A and B before I can help you.
Right. So I think one of the misnomers is it's A and B or C, but that's not true. It's A, B, and then C, which means you're going to be paying for that Part B premium. Is that correct?
Yeah, that's correct. You'll always pay for your Part B premium. And that's a great clarification to bring up, because I'm sure you guys see on the commercials, I mean, even close to the big annual election period throughout the years, you see free health insurance, $0 copays, and it looks very enticing. But yes, you will always pay for your Medicare card, but your health insurance plan now has the option to be as low as a $0 copay with a Medicare Advantage plan. Okay, so these are our main enrollment periods. You guys can take a screenshot, or I know this is being recorded, so please know these enrollment periods so that you do not miss them and that you get in contact with myself prior to these closing. If you're turning 65, that's known as your initial enrollment period, or what we call IEP. That's your 7-month window, 3 months before your 65th birthday, the month of, and 3 months after. Special enrollment periods are year-round enrollments if you meet qualifications, okay? So this typically means you're coming off of an employer plan, or you recently moved, you will qualify for a special election period, or SEP. The annual election period is October 15th through December 7th, and this is your one time of year to make adjustments to your current health insurance plan. So if you're not on the richest Medicare Advantage plan in your county, this is your one time of year to switch over to a more cost-effective Medicare Advantage plan, and your start date for the plan is always January 1st. Open enrollment period, January 1st through March 31st. We'll go into the details of that, but there's 2 things that can happen during this time. One, if you guys remember, this is your time to get your Medicare card if you missed your window. You've got January 1st to March 31st to apply for your A and B. The second aspect of this is if you're on a Medicare Advantage plan, maybe you were enrolled into a Medicare Advantage plan during that annual election period during the winter, and it's just not working for you. You know, the plan started in January, you're not liking the referrals, you don't like the customer service. You can change from a Medicare Advantage plan to a different Medicare Advantage plan during the open enrollment period as well. Okay, so our Medicare plan enrollments, IEPs, our initial enrollment periods, Medicare Advantage plan and Part D plans, you have your 3-month window before, the month of, and your 3-month window afterwards. If you're looking to enroll into a Medicare supplement plan, you have your enrollment begins with your effective date of your Part B, and it actually closes 6 months after, okay? So if you want a Medicare supplement plan, we can enroll you up to 6 months afterwards, after your birthday. Okay, so some examples of special enrollment periods. I know I mentioned this a couple slides back. Members who qualify for an SEP or special enrollment period, they can change their Medicare Advantage or prescription drug plan at that time. So again, maybe you moved a new state or a new county. This happens all the time. If you qualify for Medicare or Medicaid, which in California we call Medi-Cal, or you're coming off of a retiree plan, a union plan, or a group plan, okay, you'll be able to enroll. Please note that COBRA is not considered credible coverage, and this has happened to individuals before. They assume that their COBRA coverage is their health insurance coverage. They keep it for 6 months or they keep it for a year with their family underneath it. And when you go to apply for your Medicare card, Social Security is going to ask you, okay, you left your employer, and what health insurance coverage have you had since? And if you say COBRA, then you are most likely going to incur a late enrollment penalty. Okay, so AEP, our big annual election period. You guys, I maybe it's just because this is my career path and my industry, but I see the marketing and the billboards and the commercials left and right this time of year. So again, every year, Medicare beneficiaries can change their Medicare plans for the following year. If you are not happy on your Medicare Advantage plan or your prescription drug plan, or even your Medicare supplement plan, you'll want to get together with me during this time frame. Okay, your open enrollment period, again, 2 options here. You can switch your Medicare Advantage plan to a different Medicare Advantage plan. You can also disenroll from a Medicare Advantage plan and just go back to A, B, and D. I would professionally never suggest that because then you're losing your 20% coverage, but it's allowed during this time of year. Okay, so eligible persons may receive assistance with certain Medicare costs. Typically in Southern California, this is a conversation that I have with individuals on Medi-Cal or that qualify for low income. And there are a lot of resources that the state of that we have to assist with costs. Some people can't afford their $148.50. So we'll give you guys some examples of those.
We have a question come in. I think it's worth addressing right now, and it goes back a couple of slides.
Sure.
Who is eligible to change their benefit during an annual enrollment period?
Really good question. Okay, so anybody that is on a Medicare supplement plan, okay, let's say you've been paying for this fancy Medicare supplement plan. Maybe you didn't realize that Medicare Advantage plans existed. You don't really use it. You know, you're not one of those people that goes in and out of networks and travels. You just thought, oh, you go on to Medicare and then you get a Medicare supplement plan. So you're paying buco bucks for this really fancy, no network Medicare supplement plan. You have the option to come off of a Medicare supplement plan and enroll into a free Medicare Advantage plan. If you're on a Medicare Advantage plan and realize, hey, I'm hearing that this other private insurance carrier that my doctor takes is going to save me a lot of money, you can enroll into a different Medicare Advantage plan. And also you can change your Part D coverage. So if you are on a Medicare supplement, if you are on Medicare Advantage plan, if you are on prescription drug coverage through a Part D plan, you want to discuss your current finances with your current plan with me during this time of year, so we can just evaluate, is there a richer plan option for you? The drug formularies change every year too. So we want to review your prescription medications, make sure that you're not overpaying for your health insurance. That's the main goal. Keep all your same doctors, lower your copays, lower your prescription drug costs, and put some more money back in your pocket. Just going back to, any low income subsidy individuals that need assistance or cost assistance programs, these are all of our examples. And you are more than welcome to take a screenshot, go to any of these websites, Medicaid.gov, Extra Help is through SSA.gov. You have Medicare savings programs, and then what's known as PACE, or Programs for All-Inclusive Care for the Elderly, which is also on Medicare.gov as well. And these are state and federal programs. So, this is my close. There are a lot of things to consider when you're turning 65, coming off of employer coverage, or maybe it's just the annual enrollment period and you didn't do a deep dive into your options. It is a luxury to have a specialist, someone that has taken their time to get recertified, licensed, and to know the in and outs of all of our plans, top rated and top carrier plans in the state of California, not just specific to Southern California or San Diego. We have contracts and clients from here, San Diego, all the way up to San Francisco, as far as San Francisco, also licensed in the state of Arizona, because that's where I'm from originally. So we're here to take our time to look over your budget, your doctors, your drug costs. How often are you going to the doctor? Your likes and dislikes of your plan. Do you travel? I'm here to do the research for you to ensure that you're on the richest plan with the most benefits and that is the most cost effective for you. So again, licensed insurance agents like myself, we're authorized, we're trained, we're certified, and our services are free to you. So there is no harm in doing a consult to say, I might be retiring, or I'm turning 65, or can we just review my options here, even my benefits? Happy to do that. We're open for questions, and if everybody has any questions, about 10 minutes.
Exactly. So we're a little bit ahead of schedule. So you guys can ask questions through either the Q&A button, or there's also a chat feature. So we'll take the last couple of minutes to field questions. The first one coming in: how does Medicare juxtapose with VA benefits? Can you talk about that a little bit? It's a
great question. We've got a lot of individuals that have VA benefits, especially here in Southern California. You can have your VA benefits, keep them, never lose them, and also coordinate with a Medicare Advantage plan. There are Medicare Advantage plans that line up with VA benefits. So it gives you basically the freedom of using your VA. If you're like, hey, I go to the VA, I've been doing this for 25 years, I really don't want to change it. But you want the flexibility of also having a doctor that might be closer to you in proximity rather than driving out to the VA. There are many top-rated carriers that offer Medicare Advantage plans that coordinate with VA benefits.
Next question: can Medicare Advantage providers preclude me for existing conditions?
So what you need to make sure is that you are enrolling during your guaranteed acceptance period. Okay, so if we just follow the rules and assign you to a Medicare Advantage plan with whatever doctor takes that plan during your enrollment period, so you honor the 7-month window or the 63-day window if you're coming off of an employer plan, you have what's called guaranteed acceptance. Okay, they are not going to do a look back on your history.
Got it.
Which again is why our enrollment periods are extremely important.
Okay, next question: does the annual income evaluation for Part B get automatically reviewed each year, or do we have to request it?
You do not request it. Yeah, you do not have to request it.
I guess the question is, if income goes down, does one have the ability to request it?
Yes, absolutely. You can absolutely have it reviewed.
Okay, good.
Yep.
Okay, I think that's all the questions that are in the queue. I realize that some questions may be a little too personal. Again, when we shut the webinar down, you're going to get an evaluation, which will give you the opportunity for a financial checkup, as we call it, and to submit questions in writing. So feel free. We use those evaluations to sort of assess the content of the webinar. So if there was something that you wanted to hear about and didn't, please use the evaluation to indicate as such. Okay, we have one last question that came in, and we'll field
Sure.
this one, and then we'll give everyone their day back. What if I want to hold off enrolling until age 70 because our employer plan will go longer? Can I wait to enroll beyond the age of 65? I think that's a great question.
Yes, you can, as long as you have credible coverage. Okay, so a lot of people work past 65. I mean, my he's not retired at all. So what you do is you actually decline enrolling into Part B because you have credible coverage. What you don't want to do is get convinced that you have to have Medicare just because you're 65 and you're paying $300 a month for your employer plan and paying $148 for your Medicare card. That's overpaying for your health insurance at this point. So you can stay on your employer coverage as long as you are working. It does need to be deemed credible coverage. Usually once there's a business that has more than 20 to 25 employees, that is deemed as credible coverage. If it's a smaller kind of mom and pop shop, give me a call because we'll need to distinguish whether or not that's credible coverage. But if you've got employer coverage, it's deemed credible coverage with a larger employer or at least more than 25 employees. Stay on it. Doesn't matter if you're 70, but the dates that I want you to remember is you'll have 63 days to get your Medicare card and for us to get you on a supplemental with prescription drug coverage.
We have some more questions kind of piling on here, and since we have 5 minutes left,
Sure.
should we field these, Colleen, or what do you think?
It's whatever you're comfortable with.
Let's do it.
They're here. Yeah, we're here.
Simple protocol question. It's a great. I like the simple questions. Once signed up, how long before the card arrives? I think it's a great question.
Oh, that is a great question. Okay, so last year, oh my gosh, with COVID, it was taking as long as a month. Okay, and with that being said, things have picked up with Social Security. I usually have clients, if they call, let's say they called Social Security today and enrolled, they'll get their card within, I'd say 7 to 10 business days, maybe 2 weeks at max. Okay, can take up to 3 weeks, but let me just say this: your floppy paper Medicare card, once it's in your hands, it doesn't mean that it wasn't eligible before then. So I have some people that say, oh, I don't, I'm still waiting for my card. Like, oh my gosh, like it's kind of the end of the month and I want a January 1st effective date for my insurance plan. What do I do? We have broker support channels that can actually research if your Medicare card is activated. We can get your Medicare ID number and you don't have to physically wait for snail mail. Okay, so just want to relieve that. It can take anywhere between 10 days to 3 weeks. But if we're in a time crunch, I will find your Medicare ID number through one of our broker support lines.
Okay, and so good answer. Very last question.
Sure.
At 65, I didn't sign up for Part A or B as I am fully covered by my employer plan. Is there a problem because I didn't sign up for A and declined B?
No problem at all. You've got employer coverage. When you are going to come off of that employer plan, make sure we don't wait for the month of. We want to know when that's coming so we can start getting our ducks in a row. The goal is for you, let's say you're coming off of the employer plan this month in June. The goal is for you to have this employer coverage until the very last day of June. And we've already got your Medicare card and have submitted your application for your supplemental insurance for a July 1st effective date. So we want it to just go straight from the employer coverage right on to Medicare. So there's no lapse in coverage, but we have to talk before that effective date to do so.
Okay, awesome. Thank you very much, Colleen.
You guys are so welcome. This is really a pleasure. I know we've got almost 20, or there were 20 people on the line today. So thank you to Canter Wealth. This is a huge part of your financial future is your health insurance. It fluctuates each year. And I'm very grateful to be partnering with Canter Wealth and being able to provide these free services for you guys. We're here in San Diego. We've got an office in Pacific Beach. If you guys prefer Zoom or just a simple phone call or an in-person meeting, reach out to Mike, to Canter Wealth, and they will coordinate getting in touch with me.
Right. Yeah. Thank you so much. And I mean, again, Medicare is super confusing. It's just a small granular part of an overall financial plan. And our job is to make sure that we're firing on all cylinders. So as soon as I shut the webinar down, you guys will receive an email. You can submit questions. You can ask for an evaluation. So thank you very much for joining us. Our goal was to empower you guys, give you good information. So hopefully we accomplished that. And we are 1 minute from the noon hour, and we like to be, like I said, really tight with our timing, really punctual. So without further ado, I'm just going to go ahead and shut it down and be on the lookout for that email.
Thanks so much. Thank you, guys.
Thanks, Colleen.
Thanks, Mike.